Okay, I want to welcome everyone today. Thank you so much for joining us again. This is Alyssa Terry. I just have a few little reminders before we start. Again, please sign up for Basecamp if you haven't done that already. That's the location that we store the webinars and the meeting notes, and also post a lot of other useful resources for telegenetics. All those documents are there in Basecamp. So if you have any questions or you haven't received an invitation or want to share the invitation with colleagues, please do so, and please feel free to email us if you have any questions about how to do that. Looking ahead, the next webinar we hope to be at the end of January will be on billing, reimbursement, and financial models. But today we're going to be talking about needs assessment planning for telegenetic services. And for anyone who's ever tried to start a new program, you will know that you often have to demonstrate a clear need and a plan for the program before people really pay attention to your ideas. Our speaker today, genetic counselor Vivian Pan, and her colleagues had to do just that at Advocate Medical Group in Chicago. Vivian spoke previously to the Midwest Collaborative about this process, and we're excited to have her with us today to share her experiences and pointers. As usual, we encourage people to share their own experiences and ask lots of questions to Vivian and other members of the group. So we thank you, Vivian, for being here with us, and we look forward to talking with you.
Thank you so much, Alyssa, and it is my honor to be invited and to do this webinar for you. I'm by no means an expert. There are many, many different ways that you can get started with a telegenetics program. So I'm really looking forward to the discussion that we're going to have at the end of the webinar too. So just to give you guys a little bit of background. So Advocate Medical Group is a health system that we have in the Chicagoland area, and there are about 12 different hospitals within the system. And there's an inpatient and outpatient component to each of the hospital sites. I work for a general genetics clinic. And my primary focus is in prenatal and cancer genetics, but I occasionally cross over and cover my colleagues in pediatric and adult settings also. And I personally have a satellite clinic where I drive to, and it's, for a city girl like me, it feels like it's in the middle of nowhere. It's about 2 hours drive from my regular site, and so it equates to about 4 hours of driving to and forth from this satellite clinic that I spend every week, doing mostly cancer and some prenatal genetics. So about 2 years ago, Advocate as a whole, as an institution, decided that they wanted to get into telemedicine for multiple different reasons, and it was sort of a decision that didn't involve genetics. They started out with behavioral health, actually, in an inpatient setting with psychiatry. And our medical director, who is a geneticist, saw this as an opportunity to bring that service, bring telemedicine into the genetics setting. There's many similarities in terms of how we deliver genetic services, mainly counseling, and it doesn't require physical exams and so on. And so he went to his bosses and said, hey, why not add genetics? We'd be willing to be your guinea pig to implement this in an outpatient setting. So about a year ago, he sent me to the Southwest Tele-Resource Center's annual workshop on telegenetics, and that's where I learned a lot of these things and what I would like to share with you today. And just to let you know, next week we actually have our first telegenetics patient, so it's really, really exciting. Yeah, okay. So, Beth, next slide, please. Doesn't look like it is working. Okay. So I want to talk to you guys a little bit more about how to create a business plan. So certainly every business plan will look a little bit different, but these are sort of the fundamental steps that I think helps to help you create that proposal. I think one of the most important messages that I got from the telegenetics workshop was that it's so important to argue for that business case. And I think this is true not only for starting a telegenetics program, but also for expanding the program you have, and also for genetic services in general. So these are the 7 steps, and I would like to focus mainly on the first 4 steps today. There are certainly templates out there that are available for you to create these business proposals. So keep in mind this isn't a rigid step-by-step thing to follow. And a lot of these are almost things that you do all at the same time and maybe in different orders. Okay, so next, please. Okay, focusing on the first 4 steps. Next, okay. Yeah, so the first step is really defining the need. So really asking yourself, what is your goal for having a telegenetics program? Next slide. So this is really about asking the question, what do you hope to achieve with the telegenetics program? What is your reason for it? I think having a goal and a very clear vision of what you want out of this allows you to be a lot more flexible. You can most definitely expect that problems are going to come up. There's going to things that you will want to happen, but it can't happen. But if you know what your goals are, I think it allows you to think of ways to get around those and still achieve what you want to achieve. And it allows you to be more flexible and to compromise on things without losing sight of what you're really trying to accomplish. So telemedicine has really been around for over 40 years, and there's a lot of studies, a lot of research behind it. Maybe not specifically in telegenetics, but certainly in telemedicine, a lot of things translate. And there's many different reasons why people want to implement telemedicine or telegenetics programs. It offers improved access for patients. So those patients who live very far away, perhaps, and also allows the providers to increase their reach to different communities and people who may otherwise not come and see them in the clinic. There's also greater efficiencies. The ability to share health professionals staffing increases the efficiency and decreases the cost for a program. So because there's a shortage of genetic counselors, I think telegenetics is a very efficient way for us to see many patients at many different sites. And if you're like me and you have a satellite clinic, this really reduces the amount of time that you spend with traveling, the cost of traveling, and the less time I spend traveling, the more time I have to see patients. It also increases collaboration, giving community providers the opportunity to and access to specialists on a case-by-case basis to learn from them. And this really overall improves the quality of patient care. Studies and studies have consistently shown that the quality of healthcare service that's delivered via telemedicine is just as good as those that's given in a traditional in-person consultation. And the way I think about telegenetics and telemedicine is really not a different type of service. It's really delivering the same service in a different way. So telemedicine is really a tool for you to deliver the same high standard of care to the patients. And really, patients want this. Consumers want telemedicine. It reduces travel time, reduces costs, has more access, and studies have documented patient satisfaction, provider satisfaction with telemedicine services. Okay, next slide, please. So really the ultimate question is, what is the problem that your telegenetics program is going to solve for your institution? I think it's very important that after you think about what your goals are, you then go and think about what your institution's goals are and make sure that they're aligned. So go back and looking at your institution's mission statement, their values, what are the strategic plans, what's the budget cycle, what's the political climate right now in the institution? Are they hoping to save money and cut costs? And if that's the case, how is your Telegenetics program going to help achieve that? Maybe their goal is innovation or expansion of their services. And then if that's the case, how is your Telegenetics program going to help them achieve that? So I think it's important to know what your goals are, but also what your institution's goals are for the program. Next slide. So after defining the goals, it's very important to identify the right people. As we all know, having the right person on your team makes the biggest difference. And if you have the right person on your team, it just makes this project easier and your life much better. Next slide. So there's really two main types of people you should consider. First are your champions. So champions are people who would focus their efforts on the program, who are engaged and who you can consult regularly, people who have your back, people who will support you in your effort, and who are possibly involved in the decision-making process as well. And unfortunately, a lot of hospital system is still very much physician driven. So it's very nice to have a physician champion, or it could be your manager or your director, maybe the director of the cancer care center, or a nurse navigator, and so on. And this might be hard to do, but you probably already started this process, right? Through building relationships with your referring providers, going to tumor boards, attending meetings, giving grand rounds, and maybe you already have someone in mind. And it's certainly important to talk to this person about what your visions are, understand what theirs are too, and make sure that you guys have the same, your goals are aligned. You have to make sure that this person is accessible to you, and that they have the time for you and the time to work on this project, and they're invested in the success of this program. I think that's very important. And so not just a person who's kind of a figurehead, but someone who really will be a partner with you in this process. And then the second group of people to consider is really think about who the decision makers are at your institution. So in other words, who do you need to convince in order for this program to go ahead? Do you need to talk to the IT department, because there's definitely a technological component to a program like this? Would it be the VPs? Would it be whoever holds your budgets? Is it HR, and so on? So really thinking about who has a say and who you need to talk to. And if you don't know, this is where your champions, your physicians, managers, directors could help you direct to the right people. Next slide. So after you find the right person and you know what you want from this, the next thing to think about is, are you ready, right? So doing your readiness assessment. Next slide. And doing a readiness assessment really comprises of figuring out what you have, and then what do you need to get to where you want to go, right? So the first step is assessing the resources that you currently have. So is there another telemedicine program already? So at our institution, they already started out a telepsychiatry program. So we were able to use the telecarts and the equipment that they've already purchased when we started our pilot program. So that saved a lot of money and allowed us to start really small. They've already established a relationship with IT and figured out who is going to do sort of that technical solution aspect of it. So just having another telemedicine program within your institution, and to be honest, I didn't know that this program existed until I really looked into this. So having another program within your institution can really help take away a lot of the stress in the beginning, and you can learn a lot from them too. And maybe you don't have one within your system, but there may be another one in another institution, right? So within this community of practice, there are many people who have already started a telegenetics program. What have they done? What are their barriers? And what have they learned? And who do they use? So those are all resources that you can then use and tap into. What are some of the staffing resources you already have, in addition to just yourself? Is there a geneticist? Is there a dietitian? Do you need IT people? Do you need administrative people? If they're already doing the things that they're already doing, can they also take on these additional responsibilities? And also to think about resources that you have on the regional, state, and national level. There's a lot of information out there. There's a regional genetic collaboratives. There is also regional and national telemedicine resource centers. So their specific purpose to exist is to help people like you who wants to get started in telemedicine to get the resources that you need. So they would have information regarding the different policies in your state, different funding sources, and things like that. Technological requirements, and just a lot of information that you might not know as a genetic counselor, but these people will know. Also, there's lots of grants and government fundings out there, maybe HRSA funding, Title IV. There's a lot of funding for rural health programs. So I know you guys have a webinar in January more about these financial options and billing reimbursements. So I won't go too much into this. And it's so different for each person anyways. There's also sort of private grants, institutional grants. Some of the companies might be also putting in money for this. And I think from your survey, landscape survey, it also identifies some of the sources that funding sources that people have. Next slide. And like I said, once you take inventory of all the resources that you have and you kind of know where you want to go, then you start to have this picture of what are the things that you need in the middle in order to get there. So you can start projecting what your demand for service might be. If you know what your current referral patterns are, the number of patients at my satellite clinics that I see every week, once I do telemedicine, those are the people that would be in my telemedicine program, right? So thinking about the type of patients that you might see, new patients, is it prenatal, is it cancer, is it pediatric, is it new, is it follow-up, is it for results disclosure, and the volume of that patient and what that might look like. And then there's actually a menu that was created by the Heartland Genetic Services Collaborative, and it's a how-to guide on starting a telegenetic service. And they go through sort of step by step the different types of assessment to think about, different questions to think about. For a self-assessment, for example, thinking about if there's anything that prompted the start of your telegenetics program. Patient stories are often very, very powerful. Talking about your referral base, do you have time to do things like to do telemedicine? What are the interests in your community? And sort of what will your telegenetics program add? Staffing, who are the people that you might need for your program at your site, but as well as at the distant site where the patient is at. Think about technology, the type of bandwidth you might need, the equipment you might need, the computer you might need, and the IT person as well for setting it up, but also for ongoing support and IT troubleshoot. Originating sites, do you have someone who is willing to partner with you? So if you're going to provide the service, who is going to receive the service? And the person receiving the service, or the site that is receiving the service, what kind of resources do they have and what do we need to implement? Economic assessment, starting up, thinking about the startup cost, the maintenance cost, as well as the billing and reimbursement piece, knowing what your payer mix is, and so on will be very important. And some of these questions you might not have an answer to, and that's okay. You can go on and find out the answers, right? Maybe doing a survey of your patient population or your targeted audience or providers. You can do a literature review. There are a lot of research out there, like I said, on telemedicine, and there are things out there for telegenetics also. You can get a lot of this information through discussions, through talking to your colleagues, and by thinking through case examples. I think those are all things that can help you figure out what your needs are. Next slide. And then once you start thinking through all of these, the next step is to then really putting it down on paper, the needs and demands analysis. And I know this is probably something that most people are really nervous about. And they might be thinking about this, oh gosh, this could be huge. Do I have to do something like the NSGC workforce analysis where I hire a company and spend hundreds and thousands of millions of dollars getting all these data? Not necessarily, right? So these analyses can be very formal, but it can also be informal. And if you want to go the formal route, there might already be things that are done already, right? Every hospital really, they want to know who their patient population is. So they might already have things that they've done to look at the payer mix, to look at, the distance that people travel to look at things like that, they might have metrics that they're already collecting. So it's not something that you might need to do. And maybe your institution view this as a very important part before going forward with the project. And then you can kind of get them on board, and maybe they can include some questions regarding telemedicine in there for you. And really your goal of your business plan is really to convince whoever you need to convince, right, the decision makers, that this is a program that has value and that should be done. So you just need to be able to make a very strong argument. So maybe your demand needs and demands analysis is more informal. Maybe it's a list of all the resources that you have. Maybe it's research into the things that you need and then sort of figuring out what the difference is between the two. Um, I think when you're doing the needs and demands analysis, it's very important to consider who your stakeholders are. So are the is it the patients? Is it the doctors? Is it the subspecialists? Is it the administration? And how does this program impact each and every one of that uh, group? And I think whenever you can, use data as much as possible. um, it could be surveys, it could be focus group data, it could be past trends, things you've already collected. It could be the landscape survey that you guys have already collected. So for example, if you look through the survey, you'll note that's a very, very common issue that we have in genetic services is the increasing wait time to get into genetic services. And if you look into the survey, the landscape survey, it shows that 77% of patients, telegenetic patients, has either the same or shorter wait time compared to in-person visits. That's amazing data that you can bring to your administration and say, if you want lower wait time, hey, based on this survey, it shows that 77% of the time it's same or less, and that is amazing, right? So really thinking about what kind of data you need and how you can gather it. Next slide, please. So needs, wants, and demands. So I think I heard someone tell me that needs are really things that you need for practice or for someone to survive in order for it to function. Wants are things that are nice to have, right? Oh, it'll be nice, it'll make people happier and so on. And demand is basically wants that people are willing to pay for. Right? So you want to think about what your needs are and what your demands are, right? So that's what your administration is really going to be interested in. And so thinking about, like I said, the gap analysis, the difference between where you are and where you would like to be and what those opportunities are. A lot of business plans or businesses and practices do something called the SWOT analysis. And SWOT stands for strength, weakness, opportunities, and threats. And they do this for both internally and externally. So maybe a genetic counselor is burning out because they are traveling long distances every single week, and and, and that and that's really a threat sort of internally in terms of for the practice, right? And telegenetics could offer a solution to that. Maybe there's a competing hospital that is in the area, and they're opening up a telegenetics program. So, and maybe you need to provide the same service also. So really thinking about, for your institution, your practice, what are some of the strengths that you have, the weaknesses that you have, the opportunities that are out there, and the threats that exist. And I think thinking about that and bridging that gap between where you are is where you can make the strongest argument. Next slide, please. And part of the needs and demands analysis is really figuring out what your barriers and challenges are. Once you know what the possible challenges might be, you can be better prepared for it. And I don't think I need to tell this group of genetic counselors how being prepared is important, right? And I think the main thing I want to say about this is that, these delays and challenges, they are inevitable. You can just expect that it will happen if you're trying to start a program like this. So don't get discouraged and be patient. Keeping your goal in mind and be flexible and persistent, it will go a long way. The program that we tried to start took over a year for it to get to our first patient. It certainly can happen. And I think you guys already have a lot of great data from your survey talking about some of the barriers and challenges that other groups have had. For example, things like licensure issues, things like how to engage referring providers. I think some were concerned about how to establish that relationship with the patient without the face-to-face face-to-face contact. And so there are things out there and resources out there that can help address this, and there's solutions to these problems. And it's important to consider these as you design your program. Next slide. And then the next step is really about setting your priorities. Start small and then expand, thinking about your priorities, the institution's priorities, and making sure that they're aligned. Keeping the goals in mind, and so that you can keep pushing forward. Next slide. So creating a business plan, and after you go through your readiness and needs and demands analysis, its next step is finding a willing partner. So and I think it's so important to find someone who is committed as you are. So they want the service to happen as much as you want to provide it. Thinking through the technical requirements, what kind of IT network, the type of equipment, ongoing tech support. There's literature out there, there's information out there that you can get from the telehealth resource centers from each other about what works and what doesn't work. And there's sort of standards out there that talks about what's needed. And it's also in that manual that I mentioned in the Heartland Genetics Collaborative Services provided. And then the biggest piece is really the operational plan. So now you know exactly what you want this to achieve. You know what you have, you know what you need. So how is it going to fit all together? Where you're going to find the funding? And what kind of service delivery model do you want to use? And I'm going to give you a couple examples of telegenetic models sort of around the US. And you can also talk to each other and set up something that works for you. Thinking about ROI, so that stands for return on investment. So basically how you can increase sort of the revenue over expenditure, right? So either by decreasing how much you spend, right? So for example, how much do you spend right now? If you had a telemedicine program, how is that going to affect the spending? So for example, telemedicine will save time for traveling. That means that I can see more patients. That's more productivity. So, and reducing my travel cost. So you're spending less money for my time. Right? Or you can think about how to increase revenue and the money that is gained from the telemedicine program. And a lot of times this is tied to reimbursement issues. And this is sort of hard because you kind of don't know how much you're going to get reimbursed until you start charging it, start billing for it. So I think it's an important piece to have within a program, but a lot of times it's kind of just easier to start doing it and then fix it later. And again, I'll give you an example of a program that basically said they started billing and they didn't get reimbursed, and they went back and changed the laws within their state to require insurance companies to reimburse for teleservices. So really thinking about telemedicine as a tool that allows genetic services to be delivered to more patients and not a different type of service altogether. It's also important to think about the regulatory environment. Every state is very, very different. So you can find out, again, reaching out to the Telehealth Resource Center, and I'll point to one resource out there, and they update it and they do a really nice summary about each state and what they have, what they will and will not allow for telemedicine, and that's something that you guys can look up also on your own that's specific for you. Okay, next slide. So here are some of the resources that are out there. So the how-to guide on starting a telegenetic service, the American Telehealth Associations. I know that one of the biggest hurdles and maybe things that scares us the most is, we don't have business degrees. How do I figure this out? How do I write a business plan? So they actually have a business and finance SIG, and they have templates out there for these proposals. So you can certainly reach out to them, and they will be more than happy to help you out. There are national and regional telemedicine resource centers. There's 14 across the U.S. The CCHPCA is a website where you can find a lot of the policies that exist nationally as well as within your state. Another resource for that is you can look at certain insurance companies' medical policies that might have a lot of nice language in there. For example, United Health has a really nice one for telemedicine, and that's the website for American Telemed and the Telehealth Resource Centers. Next slide. And for your region, there are 2 telehealth resource centers, the Mid-Atlantic Telehealth Resource Center and Northeast TRC for New York. And there's their contact information. Next slide. Okay. And just really quickly, I want to give you a couple of examples of telegenetic services across the U.S. So the first one is something that they started in the public health department in Hawaii. So Hawaii has a really unique geographic challenge, right? They're consisting of multiple islands. And so patients used to have to travel by plane from neighboring islands to the main island, or they have to attend an outreach clinic if they have an abnormal newborn screen. And because it's a newborn screen, so the state is paying for the cost of all the service. Hawaii is a state that employs genetic counselors to deal with these abnormal newborn screen results. So the genetic counselors noted that these travel costs with the airfare, the rental car, the parking, the meals, the lodging, the travel time for the geneticists and the genetic counselors to these outreach clinics is really adding up. And they did a cost analysis, sort of a case-by-case scenario in terms of cost per patient. So looking at the number of patients that they see in person and at one of these clinics, and the cost of all those added up divided by the number of patients that they see. And it was costing them $346 per patient. Versus if they switch to a telemedicine model, even with the cost of the equipment, with the ongoing maintenance, IT cost, and including the cost of geneticists and genetic counselors' time, the cost per patient is $158. So by looking at this cost saving, it convinced their department to implement the telemedicine program. And so they decided to do a real-time video conferencing model, and from the Department of Health in the mainland area to the neighboring islands. And so the patients would go to the local Department of Health office, and when the nurse practitioners will help them get set up, or social workers will help them get set up. And the internet service that's provided to them was provided by University of Hawaii, and it's sort of this high bandwidth internet system that's required, but because it's a telehealth system and it meets certain criteria, the fees are waived, and so the funding is completely covered by public and partner sort of grants and so on. The telemedicine visits that they have is currently only for pediatric patients with abnormal newborn screen results with CF and alpha thal, because they don't require physical examinations. So they still have these in-person outreach clinics, but they're able to see more patients with other indications. And they're able to deliver service to selected groups of populations sooner. And they're starting small, and they're hoping to expand. They did also track their reimbursement data, and they show that in the very, very beginning, payers were not paying at all, but it slowly improved over time. And they actually went and passed legislation in 2014 that requires insurance to reimburse telemedicine visits if they would otherwise reimburse the visit in person. So this is a case where the reimbursement piece wasn't there before, but they just went ahead and did it, and afterwards were able to get that piece. Next slide. And here's a second example. I think it's really super cool. So in Arizona, there is only one geneticist for the entire state. And their wait time for the pediatric geneticist is 6 to 12 months. And the geneticist is only able to see about 8 patients a month, and with all the different volumes. And their patients are coming from all over the states. 50% of them would have to travel over 4.5 hours to get to the clinic. And a lot of them just live way too far away. So they thought, they created this telegenetics model where there's a 2-tier program. So the genetic counselors will review the cases, and depending on the indication, triage them to see either first with a pediatrician or with a geneticist. So with routine cases, such as developmental delay or more structured things like a Marfan evaluation, that would be seen by a genetic counselor with a pediatrician. So the pediatrician can do the physical exam piece, and they have a standard set of tests that they always order. If the test is positive, then they have a diagnosis. The genetic counselor would review the results with the patient. And if the test is negative, then the geneticist they make a geneticist appointment so that this one geneticist can evaluate to see if additional things need to be ordered. And so this has allowed them to create a fellowship program with the pediatricians, where a lot of times in these smaller communities, rural communities, often you have one person who is maybe a generalist, but a specialist is in one area. Or become an expert with their peers. So by including the pediatrician evaluation process, it really frees up the geneticist's time to see more cases that's more appropriate for his expertise. And this also allowed more education in the community, in the primary care community. So these are two sort of cases where there's a very specific need, right? So one is this distance in traveling and getting that access. And the second is really this wait time and thinking about ways to deliver services to get genetic services to people in different ways. Next slide, please. So just some final thoughts. So there's certainly no one-size-fits-all plan. Every institution is going to be different. The important thing is to present a solid argument. And I think the strongest argument is to argue the business case, right? Thinking about how you're going to benefit your institution, thinking about the return on investment, whether by reducing costs or increasing revenue. And I think it's really important to develop metrics to demonstrate your outcome. Collect the data, right, to show that you're being effective. And this will be important down the line to not only help others to show your administration that you're doing a good job, but also if it's a great program, then there's opportunities for expansion. It's important to know your state's regulation regarding these licensure requirements and so on, different policies and laws. Every state is different, like I said, and just because it could be a barrier doesn't mean that you can't change it. So you can certainly lobby for change if it's necessary. And just because there's no law or no licensure or no reimbursement doesn't mean that you can't do it. Right? You can always establish a contract between two institutions, and when you have doubt whether you're going to be paid or get reimbursed by insurance companies, go for a business contract or go for cash pay or self-pay options. Those are always available to you. And use the resources that are available to you. The group of community that you guys have, the telehealth resource centers, and also the NSGC mentor program. I know this is a shameless plug for me, but there are lots of providers across the nation who are doing telegenetics. So requesting them and asking their experience and having them help guide you could be very, very helpful. Next slide. So that's it. So thank you very much for having me. Here's my contact information. If you have any questions, feel free to reach out to me. And I think at this point, we would like to open it up for discussions. Right, Alyssa? And you can go to the next slide, Beth.
Yep, that's correct. So on your screen, as we've done before, there's an option to raise your hand where you can be unmuted to ask a question, and there's also the boxes that you can type in a question on the screen. So we encourage everyone to engage and either, share with us your own personal needs assessment process or ask questions to Vivian or to the group if you have any. I have a quick question to sort of get things started if nothing's come up yet. Vivian, you just mentioned outcome metrics, and that's something that the telegenetics work group has been struggling with, and a lot of people really struggle to think about what should we be looking at, what should we be measuring, and I was just wondering if your group had actually come up with something concrete that they were looking at measuring as their outcome to demonstrate the value of the program.
Actually, we have. Let me try to pull it up to see if I can get you very specific things. Okay. So for example, we looked at wait time. So we were looking at what are things that could be affected, right? So wait time was something that was very important to us. So I think a very common measure is the third available appointment. So, because
Right.
there's weird things about last minute cancels and whatnot. So that's a very common measure that people look at. We are doing a satisfaction survey, so that's also part of it. And I'm trying to think, there's two more things that we were looking at. Oh, we're also doing the billing and reimbursement piece. So luckily, our institution kind of said, money is not an issue. When do they ever say that? But, you know, uh,
Mhm.
they kind of said, telemedicine, we really believe in this. Even if you're not making any money on this, we think that there's value added. So we were able to go ahead without knowing that it's going to be reimbursed. But
Yeah.
we knew it was important. So we were going to track, number one, how many people are going to choose to pay in person versus the cash pay option. And we're going to look at, of those that we uh, do put through claims to the insurance, how many are going to reimburse us and at what percentage. So that's another piece that we're looking at. Um, yeah, and I think we're planning on also doing provider satisfaction down the line.
Great. Okay, it looks like we got a question in here. It says, are you consenting your patients on telemedicine for your genetics program? A separate consent for telemedicine or part of your standard consent form?
It is a separate consent. So we do have a regular consent that patients want, like the privacy statements and so on that they have. We did create a universal telemedicine consent form across the institution. So someone who's doing psychiatry or telegenetics all use the same one. And it's a one-page form that basically says, this is a televisit, there's some limitations, and that's it, basically. And this is a form that went through legal, and they approved all the language. So it is an additional form. Yeah. I don't think it's required. It's just something that we would like to have. Yeah.
Right. Mm-hmm. Okay, let me see. I was just wondering if you could share with us in your experience as you look through all those steps you just walked through, was there one part of it that was the most challenging part, the most time-consuming part? Is there one aspect of it that people should anticipate dedicating most of their energies to?
Yeah, I think every program is going to be a little bit different. For us, the biggest challenge was probably not knowing who should take the lead. So when we first started the program, the medical director kind of just asked me, "Hey, do you want to help out?" And I said, "Yeah, sure." And we heard nothing for about 6 months. And I prompted him. I was like, "Oh, so what's going on with this program? Is there anything I should be doing?" And he kind of just shrugs and didn't hear anything. No one's saying anything. So at one point, I just said, "Well, do you want me to just start working on it, like the workflow, just to get it going?" He said, "Sure." So I spent a whole bunch of time, brought it back to him. He's like, "What? Wow, you did so much work. Excellent." And then that's what prompted everything to start moving along. So sometimes it was sort of like knowing exactly whose responsibility it is to push this program forward. So that
Yeah.
was a very weird and interesting part that I didn't anticipate. That, oh, so things can just sit there with no one talking about it for 6 months.
Mm-hmm.
So really taking the ownership. The other really, I don't know, it's difficult, annoying part. Like I said, challenges were, it's going to happen. Delay is going to happen. You just need to expect it. And even when you least expect it, it's still going to happen. So literally the day before we launched, we had someone from billing compliance come up to us and say, "Actually, you can't do it this way." And we were like, "What? We checked with everyone in your department already, and you never said anything up to this point. We've always gotten the green light." And so what happened? So we had emergency meetings and blah, 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 and we had to basically stop our pilot for 3 months to figure out this compliance issue. So it happens, and we figured it out, and it worked. Basically, all we had to do was move offices. There's sort of issues with billing. If you're in an outpatient setting, you can't bill someone who is in a hospital setting, an inpatient setting. So we just had to move where the services are delivered. So it was fine. But yeah, so that was fun and devastating, but also
Yeah.
just expecting
Yeah.
that's going to happen. Yeah.
Yeah. Yeah. Expect the unexpected.
Yep. And I'm sure everyone's got a story like that.
Yeah. I'm just curious if, obviously the needs assessment is something that's done at the start of the program, but do you anticipate, having gone through that process, being a useful asset to the existing programs, perhaps for things like expansion or changes to the program structure, like having gone through that process? Do you feel like that's going to continue to benefit the program?
Oh, absolutely. I think this is something that should be ongoing, right? And that's why it's so important to gather the data and think about the metrics that you want to be applying, collecting. So who are your referral base, and is it increased referral, decreased referral? That could be another metric that you can measure.
Yeah.
And I absolutely think this is an ongoing process. And in fact, right, for our institution, I was not there for the very, very beginning of the discussion. They decided that they wanted telemedicine without me. And they decided that genetics would be a great place to start without me. So there are a lot of conversations that are happening sort of at a level that I'm not privy to. But I think it's still very important to go through the exercise, right? So as they're implementing
Yeah.
this, and when it was on hold for 6 months and nothing was happening, I could I was able to go over to them and say, hey, remember we want to do this, and these are the reasons why it's important, and this is how we can get it done, remember? And they said, oh yeah. So yeah, so I absolutely think this is something that's should be thought about on an ongoing basis.
Yeah.
Mhm.
Um, you mentioned really about arguing the business case. Do you feel like when we're thinking about approaching the decision makers in the administration that sort of financial aspect is really the key to getting people to pay attention?
Yeah, and I think it can be daunting because I don't think many of us have business degrees. I don't know how to do a cost benefit analysis. And you don't have to know, right? There are people with business degrees that work at the hospital who can do these things. And there's so many different ways of doing it anyways. So it's really about making a very strong argument. So if you could, I think what's very compelling are these sort of individual cases and examples that show them this is how it can benefit the program. I think if you just by saying, hey, do you know that I travel 4 hours a week to the satellite clinic? Those 4 hours mean that I can see about 1 to 2 more patients a week, and I'll be more happy and I won't burn out. That alone is a value added, right? So you can go to them and say that that's the reason why, and this is why it would save money. Someone else can crunch the numbers and show how much money it's going to save. And if they
Yeah.
really want to put a dollar amount to it, you can do something very simple, right? Just like these are the resources that we have, these are the things that we need, this is how much it's going to cost, and this is our anticipated demand. So, you know, add some data to it as much as you can, but just because you can't do a fancy financial cost benefits analysis, that should not stop you from arguing the business case. So it's not just about um, only the money, right?
Yeah.
Hmm.
Yeah. And I think that's certainly, an intimidating aspect to a lot of people, so that's useful.
Hmm.
All right, we got another. So this question is your program part of a larger telemedicine program that utilizes similar technology, best practices, and processes for documenting in your EMR? Do you have a telemedicine executive committee that meets and vets out new programs?
I would say yes and no. We do have a telemedicine director. So our department, our clinic, is actually situated under the pediatric specialty, which is really weird because we see a lot of adult patients too. So the telemedicine director is a pediatrician with past experience. So um, even though there is sort of a team that does a lot of these things, we function kind of independently from them. So um, so our director kind of helps with things like consent, things that should be the same across the board. But things like who's going to be your telemedicine coordinator for genetics, I get to decide. We decide that the workflow, how we're going to schedule patients, how the blood draw is going to be made, and so on. So we kind of work together, and they pretty much let us do whatever we want to do, except for these specific pieces. Because there is telepsychiatry, and interestingly, telepsychiatry started before they hired this director for telemedicine. So they kind of went ahead and did stuff and realized they needed an overarching person to oversee efforts across the institution, then hire that person. And she tried to get a whole bunch of things started, and we were kind of under her, but she didn't really understand what we do, so it was kind of separate. So it works, right? So I think, like I said, every institution is different, but certainly when we started, it was very, very important to get her buy-in. Right, she was one of the decision makers. So, and she was
Yeah.
very supportive of our service, and she was thrilled because I don't think there was a lot of people going to her saying, "Hey, we want to take on the work to make this happen for you." So she was very, very supportive, but she also let us run away with whatever we wanted to do.
Yeah.
Yeah,
Yeah. So sort of a little overarching coordination, but not a ton.
yeah, exactly.
Yeah.
Yeah, and you don't need it,
Um,
but or you maybe you have to deal with it. Yeah, it can work both ways. Hmm.
yeah. Um, in retrospect, when you look back at sort of when you put the needs assessment together, what you were hypothesizing was going to happen or things like that, were there things that ended up being very different than your original expectations?
Yeah, so actually, when we first started, they kept talking about doctors on demand and how they really want this program to be reaching the patients in their homes, right?
Mm-hmm.
And everyone, all the genetic counselors, are super excited about working from home in our jammies, and we don't have to go to work anymore. And this turned out to be something much, much different, right? So the whole sort of in-person thing kind of fell apart with the company we were working with, and now they're trying to start that effort again. But our goal was, my selfish goal was, I don't want to go to that satellite clinic anymore. And
Yeah.
so I didn't need to be at home. I could still go to my regular clinic as long as that satellite clinic could connect with me. So that was the most
Yeah.
important part. And that was also something that's more robust, that was already established with psychiatry. So we went with that model instead. So it was a huge difference from where they wanted us to go versus what we ended up doing. And we
Yeah.
also kept that in mind, so sort of being flexible. So just because we have a sort of site-to-site model does not mean that we can't then do site to patients at home, right? The direct-to-consumer piece. So as we're designing the program, we also started to think about how can we keep that piece in. So selecting softwares, for example, that would interface with multiple different softwares, right?
Yeah.
Both to your
Yeah.
telecard and your telepresence room and to maybe a software that's web-based. So
Yeah.
that's some of the discussions that we had in the beginning, that allow that flexibility.
Yeah.
Yeah.
Yeah. Yeah. Looks like we got another question in. Is there a telemedicine note in the EMR? I'm a dietitian, so I'm interested in how heights and weights would be documented for letters of medical necessity for coverage of medical foods and formula.
Hmm. Yeah, so the way that we have it set up, and I would probably encourage everyone to do this the same way, is to fit it into your existing workflow. So we are already seeing patients in person, so I'm doing all the things possible to make it fit into that model. right? So I'm still documenting my visits exactly the same way that I document every other visit that I do in person. And the only difference would be on the bottom, I would write a note that, FYI, this was a telemedicine visit. That's it. So really thinking about you're doing the exact same way of delivering your service and just using a different tool. So if height and
Yep.
weight is very important to you in terms of your documentation, how do you usually document this, right? Do you have someone measuring it? So if you need that piece, then maybe the site coordinator at your site should have the capability of doing that. Maybe it needs to be an MA who can take vitals and then giving you that and passing on that information to you. We have an intake form that we do. So we're basically having them fill it out at home or in person at the other site. And then the MA there will scan it in the EMR, and then I get to view it. So luckily we share one EMR between the two sites because everything is under one umbrella. But we also talked about sort of there was a different hospital, different provider. What we would do is what we normally do, which is print it out and faxing it to them down the line, which is something that we do very often. Same things with letters of medical necessity. So everything is rolled into the existing workflow. Yeah.
Yeah. Yeah. And I think, that raises a good point that any time there is any sort of physical exam piece, even if it is just height and weight, that adds a level of complexity to the requirements of the distant site, who you need there and what they need to be doing. And it's going to be a lot different if you need any sort of physical measurement of any kind.
Exactly. Yeah, and if you need a full-on physical exam, then you need a physician at the other side. So that's where Arizona, where they have the genetic counselor partner with a pediatrician, right? So really thinking about what you require for that visit.
Yeah, yeah.
Yeah.
And I think, we're just about out of time, so I think to wrap it up, so after your experiences going through this process of launching the program, do you feel like there's sort of one biggest piece of advice you would leave us with?
I would say be patient, and and a part of it is probably what recently happened, right? So I think some of the frustration is that some of these decisions are made without me being at the table. So I think you have to advocate not only for your program, but for yourself. And it's kind of a very amazing experience to go through advocating for your baby, but then also for yourself. Like, I need to be there. I need to be there to make these decisions. That backdrop is not acceptable because of this and this and this, and to really do that. I think that's probably my biggest piece of advice is you can do so much more than that you think you can. A lot of the skills that you have as a genetic counselor and we talk about business plans. Genetic counselors can make business plans. We already know how to do a lot of these things. We know our field the best. So, and what we need the best. So I think you are the best person to do it. And that's probably my biggest piece of advice. Just like, don't be afraid. Don't be scared. Jump in and do it, but expect it unexpected. And it's okay to compromise and to have to work around things and just be patient. It's going to probably take a long, long time. Yeah.
Yeah. Yeah. Great. Well, Vivian, I want to thank you so much for your time today. This was so helpful to our group as we think about how to look into launching new programs. As a reminder to everyone, this webinar was recorded and it will be available through Basecamp. The slides and the meeting notes also will be posted there. And as I mentioned and as Vivian also mentioned, the next webinar will be focusing a little more on billing, reimbursement, and financial models, which really sort of partners into a lot of the things that Vivian was discussing today and all of us better understanding what the financial piece of this looks like, which can be really relevant to needs assessment. So I think they kind of go hand in hand together. So thanks again to Vivian and thanks for everyone else for joining us.
Yeah, thank you for having me.
Okay, bye-bye.
Yeah, happy holidays.